The Trump administration's medical team testifying on Capitol Hill today, while COVID-19 cases are surging in states from Florida to California. Here's what they said about the state of this pandemic.
I know for sure, but to my knowledge, none of us have ever been told to slow down on testing. That just is a fact. In fact, we will be doing more testing.
All of us have been and continue to be committed to increasing readily, timely access to testing.
The President nor anyone in the administration has instructed or suggested that we should do less testing, have said that to me, and we are proceeding in just the opposite. We want to do more testing of higher quality.
I will certainly unequivocally state that if I receive political pressure, I will report this committee. I can tell you that I have not felt political pressure, nor has the FDA, to make any decision in any specific direction.
When you're looking at the African American community and the minority community in general as a demographic group, there are two elements that make it much more difficult for them and why they're suffering disproportionately. One is the risk of infection. Because of economic and other considerations, the jobs that the majority of them would find themselves in does not allow them to protect themselves by looking into a computer and doing telework. Most of them are essential on outside, having to mingle in a society in which the virus is circulating. And then we know from a lot of experience now that the situation regarding whether or not you have serious consequences, hospitalizations, intubation, complications, and death, relate very strongly to the prevalence and incidence of underlying comorbid conditions, which are clearly disproportionately more expressed in the African American population. Plan A, don't go in a crowd. Plan B, if you do, make sure you wear a mask. Despite any policy issues that come from higher up in the White House, we at the operational level continue to interact with the WHO in a very meaningful way, literally on a day-by-day basis. I have not directly recommended to the president to wear a mask, but I think it's very clear to anybody in the country, because I talk about it so often, of the importance of having physical distance with a mask, and if you are going to be either beyond your control or by your own choice in a crowd, that it is imperative to wear a mask at all times.
NBC News medical contributor Dr. Natalie Azar joins me now. Dr. Azar, great to see you. What did you take away from today's hearing? Was the response from the health officials today sufficient, in your opinion?
So, Allison, I think what really struck me today was, again, how important consistency is in messaging from our leadership. And in particular, how the messaging from the White House continues to undermine the message from their own public health experts. And Dr. Fauci, he almost stole my talking points. He said repeatedly, and for an example, avoiding big crowds. We know that large crowds where you can't really move in a closed arena where you're shouting and potentially not wearing a mask is dangerous. And at the same time, the president, attended a rally or held a rally in Louisiana this weekend and is planning on having more events in Arizona right now, wearing a mask. Dr. Fauci basically said, I'm not suggesting that you wear a mask. I am pleading with you to wear a mask because they know just how important it is. And of course, the president and many of the people who flank him, like today at the wall, were not wearing a mask. And of course, the testing kerfuffle with the president's suggestion that he has advised less testing, and the experts today could not have affirmed or re-emphasized more just how important testing is.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.